Malnutrition is one of the largest preventable health conditions in the world. Central Africa and Southeast Asia have large populations of those suffering from malnutrition. India is one of those countries. However, India has the ability to lower the malnutrition problem, but India's government structure has issues that prevent the issue of malnutrition to be improved. India has the most people with malnutrition issues than any other country in the world. According to the Association of Voluntary Agencies for Rural Development, 27% of India's population struggles with malnutrition. In addition, 75% of the population of India experience malnutrition at some point in their lives. Indian Prime Minister Manmohan Singh said in 2011, "The problem of malnutrition is a matter of national shame." Malnutrition can lead to different long and short-term side effects. One side effect of malnutrition is stunted growth in children. Stunted growth can be reversed. However, sometimes it also can't be, which can result in adults being far shorter than the national average. Another side effect of malnutrition is a poor immune system, which can lead to more infections, and also the infections are more likely to be complicated. And also malnutrition can lead to future health issues, such as insulin resistance, which can lead to type 2 diabetes, and also hypertension, which can lead to heart disease. And also malnutrition can lead to mental health issues, such as anxiety or depression. The majority of people suffering from malnutrition in India are those that live in poverty. The majority of people that live in poverty are those that live in rural areas and also have jobs in agriculture, such as farmers. And that is believed to be due to a lack of rainfall, which results in failed crops. And the lack of rainfall is believed to be due to climate change and is predicted to not improve. Sometimes there are opportunities for those suffering from malnutrition in India. One example is the town of Bybee-Malnutrition. Bybee-Malnutrition is a farming town. However, drought caused a number of the residents to be in poverty. The government of Bybee-Malnutrition decided to help its residents. One policy was creating a daily market so residents can sell each other goods. The government also built roads to nearby towns, which provided more job opportunities. In result, poverty decreased and the village conditions improved. However, governments in India are not as generous as Bybee-Malnutrition. The town of Gabali was similar to Bybee-Malnutrition. Gabali was a farming town, but landslides caused farming land to be unusable. The main provider of jobs for residents was a cotton farm and an electrical plant. However, both of those were shut down. Government officials received assistance from the government of India. However, the officials were corrupt and used the assistance for their own benefit. And those corrupt officials usually stay in office because they usually buy votes. Due to the malnutrition issue and a lack of health care in India, the government of India made government assistance programs for the residents. However, there are many barriers to each program. In result, the programs are not very effective in improving the issues of malnutrition and healthcare in India. One program in India is called the Integrated Child Development Services. The main population they focus on are pregnant women, mothers, and children that are up to the age of 6. The program provides many services such as healthcare, immunizations, supplements, and 300 meals per person per year for the beneficiaries. However, the program faces many barriers. Before 2005, Government of India provided 100% of the funds. However, now India provides only 50% of the program funds, or 50% of the cost for a nutritional supplement program, whatever it costs the least. Another program in India is the National Rural Health Program. This program promotes healthcare services in rural areas, and it tries to improve government spending on public health programs. The National Rural Health Mission provides different services, such as iron supplements for adolescent girls and prenatal supplements for pregnant women. This program also faces barriers. One barrier is the program struggles to improve the health of those in poor health, and is better at improving the health of communities in decent health. There have also been issues of the managers of the program stealing money from funds. And also, the states of India are not cooperative in helping the National Rural Health Mission reach out to communities. The midday meal program is another program in India. The midday meal program is specifically made to prevent malnutrition with children. The goals of the program include avoiding hunger at school, increase school attendance, and to provide meals high in fiber, vitamins, and minerals. The services the midday meal program provides is lunches for children that can't afford it. The meals include chicken, vegetables, and rice. However, midday meal program is not very effective in some schools. This is usually due to a lack of kitchen equipment to prepare the meals. And there's also a lack of knowledge in preparing the meals, which can result in foodborne illnesses or food being inedible. One of the largest barriers of malnutrition is the government not providing enough support. There is a large population in India that are suffering from malnutrition. In fact, India has the most people suffering from malnutrition than any other country in the world. The government is not providing enough support to the population or to the programs made to help the population. By providing support, the programs will have more resources to help those suffering, and in result, the number of people with malnutrition issues may decline. Another issue the government of India needs to address is the corruption within the government. The town of Kabali suffered due to corrupt politicians, and other areas may suffer if there aren't laws and enforcements for politicians. If India does not change, then the malnutrition issue will not change. People in India may continue to suffer from malnutrition, and more people may join them if the issues are not solved. And these are the references that I used for this presentation.